So without further ado, let's get started with the BPI Theater program here. Andrew Lidums is the Business Development Manager at Parker Domnick Hunter. He is presenting implementing a risk management-based approach to the prevention of mycoplasma contaminations. Andrew.
Well, good afternoon. We have a very intimate audience. Apparently this is going to be taped so that people can view it afterwards. My name is Andrew Lidums. I'm the Business Development Manager for Parker Domnick Hunter, and I'll talk a little bit today about minimizing the risk of adventitious organisms in bioprocess. So the objectives of today's talk are mycoplasma and the risks they pose. I'll talk about a contamination case study, industry recommendations, characterization of mycoplasma filtration step, and benefits of automating when one is doing filtration. So adventitious organisms are finding their way into bioprocess. Well, this is an interesting one that popped up. Genentech actually presented this at a recent PDA, and they found a 150 micron long leptospiral organism, which ended up actually coming from a drainage ditch outside their Vacaville facility. The interesting thing about this organism being 150 microns long, it actually penetrated a 0.1 micron filter, which was extremely alarming to them. They were able to solve it later by bringing the temperature down and making the organism more rigid, but as you can see, contaminations do happen, and they happen at even larger facilities. So what are mycoplasma? It's the smallest class of living microorganism. They tend to vary in size and shape from 0.2 microns upwards. And what makes them very difficult in terms of a bioprocess is that they're able to deform, mainly because they don't have a cell wall. So why are they problematic? They're very slow growing, and they're very difficult to detect. They're able to penetrate typical 0.2 micron sterilizing grade filters, and they have an innate ability to infect cell lines. So potential contamination sources are from the environment, like I just showed you the previous slide. Often they're linked to agriculturally derived components in cell culture growth media, and some species are confirmed to be associated with humans, so operators that are bringing them into the sterile suite. So the risk that these mycoplasma pose, why could it be such a serious issue? One, it's very difficult to validate detection methods, especially for large batch processes, because you're only taking a very small sample in order to run the detection. Typically, it's in low-level contamination at the raw material stage. It may not be detected, but they can in fact grow in storage. And something like Mycoplasma leitlaui can grow in high titers in refrigerated conditions. So the potential cost of getting a contamination can be very, very large. Presence of contamination may result in, obviously, in lost product. Product yield can take a hit. Patient safety, ability to get drugs to market, and in severe cases, the future of the manufacturing facility itself can be at risk. So a case study of just exactly that was in 2009. Genzyme in Massachusetts detected a contamination by a porcine virus. Production titer declines had been observed a year prior, but the root cause at the time was unknown. So these were subsequently linked to this particular contamination, which then resulted in a court-appointed independent consultant acting on behalf of the FDA. They were given significant oversight in the facility. Genzyme was then fined $175 million. and the manufacturing of products like Fabrazyme, etc., with over $1 billion in sales, were halted, causing patients obviously to be without treatment and resulting in a pile of lawsuits. And in the end, the resultant weakened stock price eventually led to the acquisition by Sanofi. So contaminations this is obviously an extreme case, but they can come to the detriment of companies. So what's the industry guidance? The PDA established a PDA Mycoplasma task force. I'm happy to say that Parker Domnick Hunter is one of 5 filter companies that are contributing to the guidelines that will be coming out on mycoplasma. And really, it's to look at mycoplasma filtration test parameters. It's to look at, cover it literally from A to Z, from basics of mycoplasmology to at-risk products and processes, trying to gain consensus among suppliers and users of filtration, and basically coming up with guidelines as far as what organism to use so we can start to standardize this a little bit. So mycoplasma detection, prevention, and control strategies. Really, to guard against contamination, there are 3 main sort of classifications, if you will. One is to establish detection techniques to identify and quantify potential mycoplasma contamination. The prevention through application of suitable controls to avoid mycoplasma entering the facility and try and make your facility bulletproof, more or less. And then finally, the control and removal through implementation technologies to thoroughly get rid of any kind of contamination that is suspected to be present. So what are the current state-of-the-art techniques that people are using to detect mycoplasma? Really, there's a nucleic acid technique and, of course, traditional microbiological techniques. The PCR methodology is very good because it's rapid and you can detect the presence of mycoplasma genetic material, but you're unable to differentiate between genetic material and the live viable organisms. And so, I guess because of the fact that you're dealing with small sample volumes in large potential batches, it still becomes a difficult task for a lot of users to identify contamination. So really, when you compare sterile filtration and mycoplasma filtration, the real differentiator is sterile filtration tends to be 0.2 or 0.22 microns, whereas mycoplasma is using a 0.1 micron filter. There's obviously a known technical report 26 guideline for sterile filtration in general, and there will be a guideline now finally coming out for 0.1 micron. The test organisms that the PDA subcommittee has selected is Mycoplasma leidlaui, grown in a specific manner, and trying to grow it to a specific size so that it demonstrates the smallest potential characteristics and the largest challenge for a membrane filter. So what does Parker Domnick Hunter come up with? We, about a year ago, launched a product called ProPore MR for mycoplasma reduction. The unique feature of this particular So the unique feature about this particular filter, it is 2 layers with a highly asymmetric 0.6 micron layer, and it is validated 3 log higher than most competitive filters on the market. So instead of 10 to the 7th log reduction value, you're garnering about 10 to the 10th or better against leidlaui organism, and that's in our validation guide. So the way we were able to put this membrane technology together, we also did not limit ourselves in terms of either flow rates or capacity, throughputs. So 3 log better in terms of mycoplasma removal, but no slower filtration times. So beyond what the PDA subcommittee is doing, we've also been working with our customers on a global basis to do some further retention studies with a variety of organisms that are appearing within customer processes. And I'm highlighting one here of Mycoplasma phoceum, where we had a international renowned third-party grow up this particular organism because, oddly enough, it's very difficult to grow outside of a process. It seems to find its way into customer processes. So to grow it in sufficient quantity in order to perform the challenge tests that we did, we had to rely on their expertise in this area. So basically what we did is we challenged 47 millimeter disc filters with phoceum. We had a different range of differential pressures that were applied during the test protocol, and we basically utilized the Silog FilterTech smart pump that could take inputs from single-use pressure sensors and gravimetric input, etc. So that's what was used. The filtrate collected and viable organisms were enumerated on dilution plates. And so what we found were some interesting results. With this particular organism, phoceum, and the way it was grown, and with the challenge conditions that we imparted, we saw a large drop-off in retention from 10 to the 7th at about half a bar of pressure. And basically, the retention data demonstrates what we think is a clear relationship between filtration pressure. Obviously, there are other parameters that come into retention of mycoplasma, but certainly in this particular study, we found that under correct process conditions, you're able to retain mycoplasma even with a 0.2 micron filter, albeit not as well as a 0.1. I haven't included that data here, but pressure seems to be something that comes as an issue when one is filtering mycoplasma. We speculate that the threshold pressure, where the mechanical strength of the cells present on the membrane is overcome, and so you literally deform the mycoplasma and they squeak through the 0.1 micron filter. So biological influences on mycoplasma retentivity. Filtration will exhibit varying retention capability when challenged with different organism species. As I mentioned, with what the PDA subcommittee is looking at with Laidlawi, there under those test conditions, I believe we ran at about 30 pounds differential, and we're still able to retain 10 to the 10th of that particular organism. But it varies by organism and the process conditions that in which the organism finds itself. So things like, for instance, mycoplasma species are sterile dependent, so the presence of cholesterol, fatty acids, or other related compounds within a process may influence cell deformity and their ability to penetrate membranes, whereas Mycoplasma species are not dependent upon steriles. But they also may be influenced in a similar fashion. So other components of media, such as those incorporated to reduce cell agglomeration or other things in a bioreactor, such as antifoam, etc., all are potential contributors to this. So one of the things that was brought into our stable of products and technologies was a couple of years back we acquired Silog, and they were very much known for single-use sensors and automation and process control. And so we've sort of melded the world of filtration with the world of automation and single-use technologies to come up with a normal flow filtration maximum pressure peaks that occur in processes can be controlled so that you don't you avoid pressure spikes or having a process run up to that greater than half a bar pressure differential, which we think is important both for maximizing your throughput of filtration but also for the retention of mycoplasma. So in the bottom right-hand corner you can see our Cyflex NFF system. It has single-use fluid paths, including the filters and pressure sensors on a skid package platform. So, in conclusion, mycoplasma do pose a significant risk to biological processes. There are numerous detection methods, prevention and control technologies, and techniques available. Higher LRV of 0.1 micron filters and their properties reduce the risk of in relation to retaining mycoplasma and penetrating the membrane. And data, we believe, show that maximum process pressure is critical and high pressure spikes are likely to result in filter penetration events. And automation and control technologies can be utilized to further reduce risk in a process. So with that, I'll entertain any questions if anyone has any. We did run some competitive membranes as well, and there was a variance between ours and theirs in regard to retention. We haven't published that particular data. We're working with a customer, actually, an international biological company, and we may publish on that in the near future. Yes, so what I showed you early on from Genentech, the Leptospira, that was found in one of their bioreactors. Yes, so the question is, can these mycoplasma grow in bioreactors and potentially damage the product? Depends which organism. Sometimes you'll get a contamination that is undetected and the mycoplasma grows in concert with the mammalian cells. So it's taking from nutrients, titers are going down, and in some cases they actually infect the mammalian cells themselves, where they actually attach to the mammalian cells, so you get a drop in titer and cell death. So basically it shuts a process down, and everything is disassembled, everything is cleaned, and then either autoclaving, steaming, and equipment, chemical sanitization. It's an awful process for those that have gone through it. But you could be shut down for literally weeks, if not months. Yes, sir.
You mentioned that Mycoplasma requests filtration 0.1 micrometers.
Correct.
And in another part of your presentation, you told that it is possible to have 0.2 micrometers. My question is, if so, is it possible to use normal technology, 0.22 micrometers, or it is still risky?
Yep. So the gentleman's question, I had presented some data on our Mycoplasma phoceum. We actually found that there was some level of retention with 0.2. I didn't post those results. it was nowhere near the log reduction value of a 0.1. In fact, with Phocium, we achieved, I think, a 7 LRV, or log reduction value of Mycoplasma, whereas the 0.2 was maybe 2 or 3. So it can retain, but not fully, and most companies will use 0.1 micron on their media, cell culture media. So it would be chemical sterilizations, autoclaving of those parts that can be and are small enough, and then steaming cycles, and then full audits of swabbing of all surfaces in a sterile suite. Probably, after an organism is isolated, to find out, that's what causes the study to be longer, is how did the contamination occur. In the Genentech case, it took them months to find out that it was in a drainage ditch nearby. So their sphere of sampling around the facility was very, very large. And basically it ended up being operator retraining. Their gowning procedures, their hygiene procedures, etc. So it's a bit like putting on the Sherlock Holmes detective cap to try and find out how it happened. And of course all this has to be documented. There's a deviation write-up, etc. So it's a long, long process. So better to be risk tolerant or risk mitigating in terms of your approach, and trying to avoid these kinds of contaminations. Thank you very much.